Section 2, 1 out of 3. In order for us to understand um, tissue interaction and how to treat our patients, we have to know these main laws. These laws govern on how the skin reacts and the type of reaction that's expected when one is treated. So let's start with the two main laws. One is the Grotus-Draper law, which simply states in order for a reaction take place, you need for the target to absorb it. The number two laws of photochemistry is a Stark-Einstein law. This law specifically states that for every one photon of energy that is gets absorbed, then you only induce one reaction. So simply stated, the ratio is 1:1. These are the targets, the chromophores. For this section, we will be diving into characteristics of melanin, what to expect, and their overtreatment signs. So we'll be focusing on these two, melanin and water. But before we do so, let us discuss briefly about Fitzpatrick skin types. Based on the laws of photochemistry, we have to know the color of the skin that we are treating. They base from type 1 to type 3. These are the easiest to treat and there will cause less complications and injury just because their lack of pigmentation, their lack of pigment, will allow you to be able to set your parameters higher compared to the types 4 and type 6. Specifically 4 and 6 with the high, rich melanin content, it is advisable for you to assess also the racial composition and genetics prior to treatment. My recommendation when you're starting to treat these demographic and skin types, phototypes, is to assess them properly and make sure that you start low with your energy settings and work your way up. Now let's start with the absorption chromophore melanin, which is the target in our skin, especially in the hair follicles. So this will be more associated with laser hair removal treatment and reduction. So what should we expect? Some follicular edema around the follicular area. You should expect some swelling and some reaction, redness, which is the most reliable endpoint. When you are doing multiples, expect the burn, that smelling burn of hair, which is normal. For signs of overtreating, you should not be seeing epidermal whitening or frosting, as this is not normal and can indicate thermal injury. Blistering or overheating of the skin, this is now showing you that your settings is too high, resulting with epidermal graying due to high melanin absorption. And I can assure you that your patient will get PIH, pigmentary inflammatory hyperpigmentation. And also you have to be careful and be aware of the pain level of your patient. If they are saying ow, 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 then then your settings may be probably too high or your pulse width is probably wrong. Next chromophore is water. 85% of our body approximately is made of water. As we all know, water is the source of the energy for oxygen and all that for our cells and for our organs. That is why being what's that word? Being dehydrated, yeah, it can cause problems, especially for organs to function properly. So when targeting water, so for the water, typical lasers used are the carbon dioxide laser, erbium YAG laser with a 1550 nanometer non-ablative, and also the 2940 nanometer wavelength lasers target water as a chromophore. When treating as such, consider the ability to cut and to thermally heat the tissue and familiarize ourselves with the fractional mechanisms such as the fractional photothermolysis. For fractional technology, knowing that's ablative and non-ablative, for ablative, it's typically you cutting the skin and setting your laser very high. For non-ablative, you control the density for the MTZ. So MTZ stands for microthermal zones. Expect downtime, especially for the ablative treatments, week to 2 weeks, depending on your patient and how they follow their post treatment guides and their follow ups. Going back to ablative versus non ablative, here is a diagram on the left here showing you, well, not diagram, illustration on ablative. So you can see there's two parts. It's cutting through the epidermis, which is the top layer of the skin. And then we have the dermis, which is the second layer of the skin. So it cut through the epidermis and then penetrates to the dermis. So this has the most transformative effects compared to non-ablative. That's why it's safe and less downtime as it bypasses the epidermis. So there's no injury on the epidermis side and it penetrates the middle layer of the skin, which is the dermis. Going back to MTZ, once again, microthermal zones. Each space here is healthy tissue, which allows it to heal faster and generate more cooling for the skin. You can see here on the 800 dots, it's way denser than this, so expect longer downtime. So when you're having this spacing, the further out, you're doing more like a less aggressive treatment, and when you're going denser, you're packing the energy there. There's gonna be less microthermal zones, so expect longer recovery. So downtime, it's plain and simple. The lower the density, then the faster the recovery, the shorter the downtime. For higher density, expect longer recovery times, maybe some complications, but better effects. There's a price for beauty and improving our skin. So going aggressive will yield you the best results, but also be aware of the potential complications. And if it does arise, then just make sure that you're able to manage and deal with it as they come. For clinical endpoints for the cutting side or the ablative, uniform ablation of the epidermis, which is the top layer of the skin. You should see some smooth, even pattern on the microthermal zones. Light charring or bronzing. This now happens when your settings pretty much high. For very aggressive treatments, this is normally I've only seen this used by plastic surgeons, even during a facelift. You will see pinpoint bleeding when the dermis is reached, which still is safe and normal. For non-ablative, more for the coagulative mode, mild to moderate erythema, some diffuse edema or some swelling or mild bruising, bronzing over days, and this is just specific for the 1927 nanometer thulium laser, not the 1550, and a sandpaper texture type. So when you see all this, then you are in a good state. Now for complications, a charred tissue with smoke, which means the CO2 is just too strong. And also you overstacked on that area, which you did not allow it to cool down. Deep bleeding means your setting is too high, so it's penetrating way deeper, and now it's affecting the subcutaneous layer, which is the last layer of the skin. In worst cases, you notice the skin to turn gray and feeling like a leathery tissue. This is now a cause of thermal injury, still related to overheating. And watch out for excessive swelling lasting greater than 72 hours. And this is the end of section 2, 1 out of 3. Any questions? Let's discuss that when I see you all. Thank you very much.